Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to take actions to make a better system for all of us. Before we get started talking about computer IT related things and healthcare, as well as insurance companies messing with providers in a bad way, I want to point out that down below in the YouTube description box is the address, the URL address for the Healthcare Advocacy newsletter. If you go there, you can subscribe for free, and it is the text for today's video. All of the links and actions and background material I mentioned and links to research journals, it's all in that newsletter. Subscribe for free. Okay, let's get started. First, I want to talk about anime. You may not be familiar with that. Anime are cartoons. Now, my wife and I occasionally watch anime cartoons, often from Asia. We stumbled upon one called Parallel World Pharmacy, and I'm sharing this because the message of this series of cartoons is that medicine and healthcare should be affordable and available to everyone. They also point out that society should have an obligation to make sure that there's sufficient affordable daycare to help all families, because having children should not be an oppression on the family. It shouldn't be burden, with the case they made, it shouldn't burden women so that they are precluded from pursuing other interests, like going back to work. Anyway, here's the official description, and we were very taken with this. When pharmacologist Kanji Yakutani dies, he probably wasn't thinking he'd be reincarnated as a boy apprentice in a medieval world. The distinguished medical researcher finds himself now surrounded by quack medicines swindling the common good. With his past experience and a new set of supernatural powers, he'll go from cutting-edge medical technology to now reforming healthcare for all. Honestly, it's hard to believe it's in a cartoon, but I found it really good. Anyway, I have a link to it in the newsletter. It's on Crunchyroll. Okay, let's talk about Parkinson's and deep brain stimulation. This is also sort of a software story. More than 10 million people globally live with Parkinson's disease, for which there is no cure. Deep brain stimulation, DBS, is a surgical treatment that helps alleviate some movement symptoms of the condition. People with Parkinson's can still encounter, though, movement issues when using the current DBS technology. Good news, researchers from the University of California in San Francisco found that adaptive deep brain stimulation that uses AI can reduce the time a person experiences the most bothersome Parkinson's disease-related symptoms by about half. And there's a link to the news story in Medical News Today. They published their results in the journal Nature Medicine, and there's a link to that in the newsletter as well. An adaptive DBS continuously monitors brain signals that best track a patient's symptoms. When the algorithm detects a change in the brain signal, it adjusts stimulation intensity in real time, instead of just always being the same level, which could be problematic. This means the device will deliver the correct amount of stimulation that the patient needs to adequately control the symptoms. To implement adaptive DBS, the authors developed a data-driven analysis pipeline that identifies the brain signals that indicate changes in symptoms, as well as the adaptive DBS algorithms embedded in the research device. This means it always figures out, over time, the best amount of signal to provide to the patient to control symptoms. So cool. Cybersecurity in medicine, let's talk about that, because that's a nightmare. When medical computer systems are attacked, everyone suffers. Patients can be left with insufficient care at critical moments. Doctors may be unable to get patient history or tests or lab or imaging results. Pharmacies can't verify and process prescriptions. Payments can become non-existent, and insurers may be unable to authorize payments or treatments. What a nightmare. Cyber attacks against the U.S. healthcare system, the sector, have more than doubled between 2022 and 2023, according to the Cyber Threat Intelligence Integration Center. In February, a devastating attack on Change Healthcare, a company that processes healthcare payments, wreaked havoc across the United States. Just this past May, there was a ransomware attack that hit Ascension, a Catholic health system with 140 hospitals in 10 states. Doctors and nurses working at Ascension reported medication errors, delays in lab results, and these actually harmed patient care. Now, the Biden administration recently announced, and there's a link to their announcement in the newsletter, some protections meant to tighten cybersecurity in healthcare. The announcement included, this is actually really important, a plan for tech companies Google and Microsoft to offer various cybersecurity services for free or at discounted prices to hospitals that could otherwise not pay for the latest and best cyber defense. The government's announcement also contained a number of valuable services. It includes access to the Health and Human Services Tools and IT Recommendations website. It is valuable. I have a link to it in the newsletter. I went and looked. If you're in this field, go have a look and make sure that your IT department has a look, because they cover a wide range of the best practices to protect systems, all kinds of systems, email systems, data systems, patient records. Go take a look. Anyway, these things help, but there's something else that will help, and it has to do with the way the U.S. has chosen to store data. Now, the credit card in your wallet likely has a chip, a computer chip, that's used to authorize purchases and can save a tremendous amount of information on the chip. It was invented in France, and in 1998 it was rolled out for the Carte Vitale, the French health insurance card. It was not done for credit cards. It was done for the insurance card. Patient medical records are all there on the card. That means that if there's a cyber attack, your doctor doesn't have to, or pharmacist doesn't have to rely on the internet to access your medical records. They can just look on the card and see what appropriate doses are for you. Find out whether you have allergies to medications, what treatments have worked and have not worked so far. Anyway, the patient's data, of course, is backed up elsewhere when it's modified. So if you lose your card, you can get another one. While we're on the subject of software, let me point out that the format that the U.S. uses for medical records is not common. But in countries that have universal health care, they use a common format for electronic health records. It saves effort for everybody, and you have instant interoperability across the entire country. Now, we've had electronic records for more than a decade, and the government actually paid doctors to transfer paper files to electronic records, but we did not demand a common format because we chose to allow industry to seek proprietary advantage with private formats. Now, specifically, there are no standards for semantic interoperability of healthcare data in the U.S., only syntactic records. This means that while the data may be packaged in a standard format, it lacks definition or linkage to a common shared dictionary. Our national implementation did not have a national interoperability goal. Anyway, if we had universal health care, we could all have a smart health insurance card, use common electronic health records, and many of the healthcare cybersecurity issues that we face would be by the wayside. Anyway, there's a link in the newsletter to an NPR story that came out today on the subject. Feel free to access that one. The next thing I want to talk about is insurance interference in care. We've talked previously about insurance companies demanding prior authorizations and denying claims and the like. This one is specific to mental health. A recent investigation into mental health care by Politico revealed that the insurance company behaviors that we're seeing are driving psychologists out of the networks. Now, I actually have friends who have quit. They were well-known psychologists, and they quit completely because the experience they had with this sort of negative behavior from insurance companies was so difficult to deal with. The techniques that the insurance companies use keep reimbursement rates super low, cut paid session times to 45 minutes, hounding the psychologists for an end date of treatment, and of course denying care, claiming that symptoms were not sufficiently severe to warrant treatment. Much of this for patients that were suicidal. Doesn't that sound great? Psychologists whose claims were denied were left on hold with customer service for hours. One estimated he placed over 20 calls to the same insurance company for the same claim trying to be reimbursed, and he could have earned $5,000 for the time he wasted with that insurance company. Annalise Hansen is a former Cigna manager and a therapist, and she worked in their behavioral health department, and she said that customer service problems can be traced in part to a decision that Cigna made years ago to outsource those calls to the Philippines, and that overseas employees often lack access to the full claim system and often are unfamiliar with complex medical terminology in English, so they're not really able to offer much help. She quit Cigna and she returned to private practice. And she had claims with Cigna, and then they put her on hold for 2 hours while she tried to get her claims paid. Her comment? I quote, "The idea is you make it so frustrating for the providers to follow up on claims denials, they're just going to give up and the insurance company is not going to have to pay out." It couldn't be clearer that the insurance companies want to acquire the patient's premiums and not make the payments. Well, guess what legislation does cover mental health care? Oh, you already know. And they can do it in a patient-centered way, making sure that providers are paid for needed care. You're right. It's national health insurance trusts. If we had one, we wouldn't be in this ballpark. Let's let our elected representatives know. Here's an action we can all take to try and fix the situation. You can call them, and I'll put a link to a website so you can get their phone number or email, or you can, on your phone, send a text message to 50409, and here's the message: sign, SIGN, space, PZY, trying to read it, IGT. Got it. Sign, PZYIGT to 50409 on your cell phone. Here's the message. I'm your constituent, and I want you to know that insurance companies claim to cover mental health care, but they're shortchanging patients and providers alike. They deny claims for treatment, make providers wait hours to talk to customer service to try and get reimbursed, cut the allowable treatment time, and seek to cut off treatment. They even do this for patients who are suicidal. As a result, providers are leaving the insurance company network and leaving so many patients without care. Here's a reference that our elected representatives can have to the ProPublica NPR story. In addition, what does work is H.R. 3421, the vastly improved Medicare for All bill in Congress. It covers these services. And as my elected representative, you should go look at the text of that bill. Go look at Title II, Part A, Section 5. It's on page 11. And here's the text. I include a link in the email. Look, we sent you to Congress to fix problems. I don't want you to put a Band-Aid on this wound in the healthcare system of mental health providers not being paid with some obtuse rule for insurance companies, and then they just weasel around it and continue to cheat patients and providers. I want you to pass universal health care for all of us. Make sure all of us can get the treatment we deserve, not the runaround from insurance companies. That's what I've got for you. Down below, you can like, share, subscribe, send me a comment or a suggestion for a topic you'd like to see. You can also send comments to healthcareadvocacy1, all one word, at gmail.com. That's it. Have a good day. We'll talk tomorrow.